So what do we do with it? Treatment is multimodal, and that means that we use a lot of different approaches, psychoeducation, pharmacotherapy, individual and group therapy, not necessarily just with the child or the young adult or the adolescent that has ADHD, but with the whole family. And then, peer support, things like this, come into a support group or attending, speaker talks about the topic, or getting together with friends, seeking out places in your community to learn more about ADHD. Same is true for treating substance use disorder, learning more about it, engaging in group or individual cognitive behavioral therapy, medication, and peer support, whether it's a 12-step program or something similar, Al-Anon. There's lots of different approaches, smart recovery. Those are all great ways to treat substance use disorder. And not surprisingly, if you have to treat both, you do the same things. Education, pharmacotherapy, group therapy, individual therapy, and peer support. Okay, so what are we talking about when we're talking about prevention, though? Prevention means treating now. And again, that's with medication, education, and support. And so we'd like to catch our kids before they start trying drugs and alcohol. And that usually means treating them with medicine and, helping them understand what the risks are. These are some of the medicines that can be used to treat your child's ADHD, but they also help prevent the development of future substance use disorder. I talked to you before about my son, Theo, the one who started our kind of ADHD journey. He's 19 now. When he was diagnosed, he was 3. He was probably 3.5. And like most parents, the last thing that we wanted to do was start our 3.5-year-old son on stimulant medication. However, my sister had just gotten out of jail, and my brother had just completed his 2nd round of inpatient treatment for cannabis use disorder. And we'd kind of divulged all of our family history when Theo was getting diagnosed. And looking back, this was 15 years ago or more at this point. It's kind of amazing that we found a nurse practitioner to work with our son who was as informed and advanced really as she was. But she looked at us and she said, all the research is showing that if you start Theo on stimulant medication now, the chances are, or the odds are, that he won't ever have to go to treatment for an alcohol use disorder or an addiction of any kind. Everything is showing that if you start treatment early and he stays on treatment for at least 5 or more years, he probably won't become addicted to anything. He won't ever have to go to jail, at least not as a result of substance use disorder. He won't ever have to go to a residential treatment for alcoholism or addiction. And that was all we needed to hear. We were like, sign us up. We're sold. And it's worked. And we'll talk a little bit more about side effects and all that kind of thing. And this is where I think people sometimes get nervous, because I am pro medication because I know that it works. I went back to graduate school a few years ago so I could diagnose adults with ADHD and work with those that were diagnosed late and had maybe developed addiction along the way because they were trying to self-medicate and figure out a way to balance out the things in their brain that just weren't working. And I've seen time and time again, people who end up in jail, who actually have ADHD, who become addicted to drugs and alcohol along the way. And they really had ADHD. And if someone had diagnosed them, caught them, treated them, done some education, their life could have turned out very, very differently. And so I'm really passionate about this, and I'm passionate about medication because I've seen the difference that it makes for people, and I've seen the success stories. I know that medication is not for everyone. It's a very personal decision for families, and I understand that it doesn't work for everyone. And there's lots of other things that you can try. But the thing that seems to work the best is treating kids with stimulant medication if they can tolerate it, keeping them on it, and doing psychoeducation and the other things that I showed you before in that multimodal approach. Okay. And, it seems, again, counterintuitive. Why would we treat people with a medication that some people become addicted to? And the truth is that stimulants don't cause addiction, and that treating ADHD effectively, again, like I said earlier, may help protect against substance abuse. And there's, I think, 33 studies now, 33 studies, different studies that have shown that. And so, there's a whole range of numbers in terms of percentages about what the actual reduction is, or the actual possibility of developing and reduction and all of that. But I mean, it's anywhere from 30 to 50%. 30 for the likelihood of a child developing a stimulant use disorder or a substance use disorder when they have ADHD, if treated with stimulant medication, can be reduced by up to 30 to 50% with treatment. So like I was saying earlier, why does it work? Well, we think it helps, relieve those ADHD symptoms that causes, kids and young adults and adults to seek out substances to help balance out that brain chemistry. And in fact, it's showing that there's more risk in not treating ADHD with stimulant medication than there is in treating with stimulant medication. Many of you are already on board. You're like, yes, Jeremy, we treat our our kid is already on stimulant medication. But for those of you that haven't had a chance to try it, or are thinking that it maybe is something that you're not willing to try, or you're just kind of getting into the medication process, it's not a straight shot. It's definitely trial and error, which you wish it wasn't, but unfortunately it is. Most people end up trying between 2 or 3 different medications before they get to the right one. And sometimes, the first one is so bad, or doesn't work at all, and people get frustrated and aren't willing to try, again. I want to encourage you to try again, because there's so many different formulations of medicine now, so many different ways to deliver medicines, and most people respond well. You do see some common side effects: weight loss, anger, irritability, kind of that rebound effect, trouble with sleeping, some emotional blunting. But those are typically dose related and can be adjusted so that those go away. So there's no evidence now of a difference in height or weight in adults with ADHD who take stimulants. I go back to Theo, my 19-year-old. He's 6'4", and he has been on Vyvanse ever since he was 4 years old. And he takes it twice a day. He's taken it twice a day since he was 4 years old. And again, he's 6'4". And there was times when, he was pretty skinny, but he's caught up, and maybe he's thankful if there was a reduction, but none of the research is showing any side effects related to height or weight long-term. For some reason, our kids don't stay on meds. Those who even start meds go off after 3 years. Not entirely sure. A lot of times I think that teenagers and adolescents decide they don't need the meds, or they don't actually have ADHD, or they want to try to do it without the meds. And that is, of course, like the worst time for kids to go off their meds, because that's when there's a lot of different options and social cues and social pressures out there to try different things. And so, if your child wants to go off medication, either in junior high or high school, then it's time to have a conversation about why that's not a good idea, and what you can do to put together like a therapeutic trial to convince them that their medicine is actually working. Because we talk about the side effects of not being on your medicine. And those are some pretty scary things. I probably should have put I'm going to scare you slide right here instead of several slides back, but you guys can read that. I'm not going to read it to you because it depresses me. But, kids who have poorly managed ADHD or undiagnosed ADHD have horrible life trajectories. Very, very sad things can happen. And so treatment is important. So like I said earlier, I'm pro medication because it works. It's, up to 3 times more effective than any other intervention we have out there for ADHD. We have a huge evidence base that shows that these medications are safe. In fact, they're some of the safest drugs used in all of psychiatry. Between 70 to 90% of kids and adults respond to this medicine. I can't think of any other chronic medical condition that has a treatment that is 70 to 90% effective and is also incredibly safe long-term. They're easy to administer. Like I said, there's a bunch of different ways that you can take them, dose them, get them. You can patches, pills, liquids, there's like chewables now. There's all kinds of different ways to administer medicines, and they're less expensive than, psychosocial interventions. That doesn't mean that you should just do medicine or just choose medicine because it's cheaper. The psychosocial part is important as well. And that's, learning skills, talking about executive function, areas of opportunity, that group support that we talked about, identifying the risks and talking about what that looks like. The other piece too, particularly as kids get older, once the stimulants are on board, they're on board. And so you don't have to rely on a behavior chart or the babysitter or some other method of reinforcing your child in their behavior. When they're on meds and they're on the right med and it's at the right dose, they're going to be pretty much okay during that time period. And so again, there's those 33 studies that show that if people stay on their meds for 2 or more years, ideally 5 or more years, that it actually helps our kids' brains catch up faster. I showed that slide earlier that talks about the 3 to 5 year developmental delay. Stimulant medication actually helps your kid's brain catch up faster, which I'm sold. I know I'm probably preaching to the choir. These are some of the nice benefits of stimulant medication, in addition to preventing later substance use disorder. In the immediate, it reduces parent and family conflict. It reduces symptoms. It reduces the risks of health related problems, accidental injury. This is a big one. Economic burden on the family, punishment from others, like at school. Also improves working memory because again, your brain's catching up. And when kids feel better about themselves and more confident, then they do better in almost every other area of life. So helpful overall. New research is showing that earlier initiation of stimulant medication helps to kind of increase the amount of, or decrease, I don't want to say that. It lowers the potential for substance abuse down the road more so than starting medication later. There seems to be a lot of evidence to support initiation of medication at around before age 9. That doesn't mean that if your kid's not diagnosed till they're 10, 11, 12, 13, or high school, that's not, that you can't start medication then, or it doesn't mean for sure they're going to become addicted. If you don't start stimulant medication later, you may not even have to start stimulant medication. Just getting diagnosed and having your child understand what the risks are and working on different methods to approach situations where they may engage in risky behavior can help. But again, earlier initiation has shown sort of the biggest impact down the road in decreasing the chances of developing substance use disorder. The other piece too, so don't wait to start stimulant medication, but encourage your kids to wait until they start trying drugs and alcohol. Your kid's school has probably got all kinds of programs to encourage waiting, but it's a big deal. We know that kids with ADHD, usually start using substances 2 to 3, sometimes 4 years before their same age peers that don't have ADHD start drinking or smoking or using substances. And so the longer that we can get our kids to hold off on trying these substances, again, the decreased likelihood of them becoming addicted to those later in life. When there was a study that talked about family dinner, it came out a long time ago, that if we all sat down for family dinners and had conversations with our kids, that would decrease the likelihood also of them becoming addicted to drugs and alcohol later. My friend Tanya always says, I have to have dinner with you so you won't become addicted to drugs. So that's, I don't know that that's actually shown to make a huge difference. And I don't know that in our, our lives today, it's realistic to think that we can all have family dinner every night. But I think the key piece here is communication, right? Keeping the lines of communication open and having conversations about ADHD, about failure, about drugs and alcohol, about the increased risk, that just by having ADHD, you have an increased risk of becoming addicted to something. And if there's already addiction in the family, either in parents or grandparents or uncles or aunts, then, that number goes up a lot. And so just making kids aware that risk is out there helps. And this is the part that my soapbox, if somebody in the family has ADHD, somebody else in the family has ADHD. So if you have a kid that's been diagnosed with ADHD and you or your partner or, everyone else hasn't at least gone through at one, a screener, that 12 question screener to see if there's a possibility that you may also have ADHD, please do the screener. Screen your kids' siblings, screen yourself, screen your partner, and if you can get your siblings screened, go ahead and do it, because wouldn't you rather find out and know now? And again, like we said before or earlier in this presentation, ADHD shows up about 10 years before kids pick up their first drink or cigarette or whatever. And so if you had the opportunity to prevent someone else from going through negative life trajectories, wouldn't you do that? Okay. So sometimes people come to me and their kid's diagnosed, or their kid didn't get diagnosed till they got to treatment because for whatever reason, but they've already started using, maybe their kids in high school, or, there's some kids in junior high who start using and become addicted, which is, terrifying to think about, but does happen more often than you would think. What if your kid's already using and they have ADHD? Well, you still have to treat both. You still have to treat both the ADHD and the substance use disorder, because if you just treat the substance use disorder and the kid or the young adult just gets clean or sober, they still have ADHD. So they still have that chemical imbalance that they're going to try to find a way to fix, and they still have to get through life having ADHD. So believe it or not, people who are in recovery take stimulant medication. And that's because, if you take away someone's solution, so if we believe that people who develop substance use disorder who had ADHD are actually self-medicating, the self-medication, the addiction, the alcohol, the drugs, that's their solution to whatever the problem is. So if you take that solution away and you don't create something else or treat the underlying cause, you're going to fail. They're going to relapse, and they may develop additional and more complicated problems. And so we have to figure out a way to treat both. So people who are in recovery do take stimulant medication, and that's actually the recommendation. And it's a little bit shocking when you talk to people who have been through treatment programs or in treatment programs, and maybe they've just been diagnosed with ADHD, maybe they already had ADHD, and you find out that they are actually now on like high dose stimulant medication. But that is unfortunately, or fortunately, what is needed to help them treat their ADHD. And there's, again, lots of really new research. You can see the most recent study there. There's more, but this is the one that I cited is from 2022. So for those people who, went to treatment, I think this was for alcohol use disorder, who had ADHD, they started them on stimulant medication. They ended up needing about 40% higher dosage than what the starting dose was. Not all of them did, but they found some physicians who were willing to push it a little bit, because if you think about it, by the time people get to treatment, they've been using a lot of things to excess. And so their tolerance is already a little bit higher. And so when you start the stimulant medication, if it's not high enough to be effective, then it's not going to be effective. But what they found is that, when they do start stimulant medication early in recovery, in treatment, people stay sober longer. They're more likely to stay in recovery if they continue taking their stimulant medication. And there's a 72% decrease in cognitive impairment. A lot of times when you see people who are going through withdrawal or no longer using substances and going through treatment, there's that brain fog that develops. And for those that were treated with the stimulant medication who also have ADHD, they found that brain fog cleared more quickly and that their brain actually recovered more quickly. I work with clients sometimes who have been clean and sober for up to 18 months, and they still have sort of the post-acute withdrawal symptoms or syndrome, because their brain has not recovered and they're still struggling with all kinds of different issues and problems. And, for those that have ADHD, stimulant medication and starting it again early on can really help. You can only use extended release formulations, because the short acting formulations, and I think this is true for almost everyone. This is my own personal opinion though. I mean, short acting stimulant medications seem to be really hard on the body, and particularly for people who either have a family history of substance use disorder or have had challenges with addiction of some kind. They should not be on short acting medications. They should only be on extended release formulations, because it doesn't slam into your body the way that a short acting one does. And it doesn't, drop off the way a short acting one does. An extended release formulation has that kind of smooth blood level, so you don't see as much rebound. And the client doesn't feel that raciness sometimes that comes with the short acting formulations, which can actually be sort of a trigger for a relapse as well. You guys may have seen that with your kids too, when they were probably starting therapy. So again, if they can't take stimulant medication, some people can't tolerate it. Some people aren't willing to risk it. There's lots of other ones. Antidepressants work great. The Strattera and Qelbree, that's atomoxetine. are non-stimulant medications that are indicated for ADHD. They don't work great for everybody, but for the people they work for, they do work great. Guanfacine is intuitive, and that seems to help with anxiety. In some clients, it does seem to work better when used in combination with a stimulant. But if for some reason you can't tolerate the stimulants, then you see people taking intuitive by itself. And then bupropion is Wellbutrin, and that is one that, again, either works really, really well or it doesn't work at all. But there's other options besides stimulant medication. Sorry, end of the day, stimulant medication. If you do have someone in recovery in the house, and we're worried about relapse, this is something I just throw in there, because the things that help people who are in recovery from relapse also help kids and adults who have ADHD. Anytime we're hungry, angry, lonely, or tired, we're more likely to have a kind of an emotional meltdown. And so keeping that in mind, and I tell my clients all the time, boring is good. I'm going to ask you how you're sleeping. I'm going to ask you if you're eating. I'm going to ask you if you got some exercise, if you're staying hydrated. I'm going to ask you if you got out of the house. Again, some of the basic things and the most boring things are the things that make the most difference. If you're an adult who has a kid with ADHD and you've not been evaluated yourself, please get diagnosed. If you're one of those parents that has said, I'm sure I have it, but I haven't been diagnosed, go get diagnosed. All right. Any questions? Let's see. Got some in the chat. I'm going to go ahead and actually, I'll leave the share up for now. Okay, what do we got here? Rhonda's saying that her son, let me stop the recording actually, so that way, if you guys want to talk about anything in particular, you don't have to worry about it being on the recording.